physios, welcome back to our channel. Previous topic we have discussed about this topic, controlled breathing during walking. So exercises for the breathless patient, controlled breathing during walking, and in that paced breathing with steps, use of burst breathing while walking, controlled breathing during functional activities. Exercise for breathless patient, exercise tolerance testing, 6-minute walk test, program for exercise program for the breathless patients, intensity monitoring, special considerations. In this topic, we are going to discuss about the chest physiotherapy technique. So let's start the video. Including vibration, chest shaking, percussion, postural drainage with indications, precautions, and mental portions of the program. So vibration, chest shaking, and percussion techniques. Percussion means clapping. The purpose: loosen the thick pulmonary secretions from airway walls to help mobilize them towards a larger airway for expectoration. Technique: hands cupped like a bowl, rhythmic clapping over the chest wall on inhalation or exhalation. Duration will be 2 to 3 minutes per segment. Percussion: perform over a towel or gown, never directly on the skin. Avoid bony prominences, especially spine, scapula, sternum. Clinical use: pneumonia, bronchiectasis, cystic fibrosis, post-operative, and also ICU patients with the retained secretions. And for whom we'll proceed for vibrations will be the purpose is to help move the loosened secretions towards the central airway, especially during expiration. The technique: therapist places the hands flat on the chest wall as the patient exhales, apply a fine oscillating pressure using isometric muscle contraction. Repeated for several breaths. And the next is chest shaking. The purpose is to intensify versions of vibrations usually performed on deep expiration to further mobilize the secretion. Technique: therapist placed both the hands on the chest, applies a gentle bounce like shaking during expiration. Used cautiously in frail or elderly patients. And the first thing is about percussion. First thing is about vibration, chest shaking, percussion. The techniques. Next is chest shaking. Next is postural drainage. So postural drainage, what is different with postural drainage? So postural drainage is a positioning technique that uses gravity to drain the secretions from specific lung segment towards the trachea, where they can be puffed out or suctioned. Indications are retained or excessive secretion, example bronchiectasis, cystic fibrosis, atelectasis due to mucus plug, ICU patient, post-operative chest infections, chronic bronchitis, aspiration pneumonia. And for whom it is contraindicated, in contraindicated we do have absolute and relative. Absolute: severe hemoptysis, uncontrolled hypertension, increased ICP, that is intracranial pressure, or pulmonary embolism, recent spinal surgery, or instability patients. Relative contraindications will be rib fractures, chest trauma, GERD, gastroesophageal reflux disorder, esophageal varices, anxiety, nausea, pregnancy in some positions, cardiovascular instability. Monitor carefully. What are the general precautions? Avoid postural drainage immediately after meal. Wait at least 1 to 1.5 hours. Next, monitor for the hypoxia, cyanosis, bluish discoloration of the skin, dizziness, whether they are normal or dizzy. Use of pillows or supports to reduce the strain. Always perform bronchial hygiene, coughing or suction after feeding. Preparation: explain the procedure clearly to the patient. Ensure the comfortable room temperature. Use pillows, bed tilting for positioning. Increase diaphragmatic breathing or coughing. Combine with the percussion of vibration. So what is percussion? With the clapped hand, vibration is giving amount of vibration from the shoulder to elbow through and palm during positioning. Postural drainage positions for specific bronchopulmonary segments. Assuming standard 45-degree tilt where needed. The lung segment, patient position. If this is the lung segment, upper 1, 2, 3, 4, 5, 6, 9 segments are there. Apical segment, upper lobe, sitting upright. Posterior upper lobe, sitting or leaning forward over a pillow. Anterior upper lobe, supine, flat. Right middle lobe, left side lying, head down tilt. nasal lobe, lower lobe, sideline, head down, tilt, affected side up. And superior segments, lower lobes, crown and flat belly. Okay. This is actually a concise note. If you want to make me a detailed version, we can go for it. But the video length will be very, if it starts from 10 to even 30-50 minutes. If you want me to make such type of detailed video, please do me for any topic I can make related to physiotherapy or any medical conditions. Modified postural drainage for elderly, pediatric, geriatric or post-OD patients where full head down tilt is not tolerable. Use mild tilts or upright segmental positions combined with the incentive spirometry active cycle of breathing, that is ACBT. Continuing postural drainage as a whole program. Teach patients or the caregivers cat positions for affected segment. Timing 2 to 3 times per day or as noted or as needed. Each position helps up to 5 to 10 minutes. Integrated deep breathing plus huffing or coughing. Use pillows or bed props if tilt is unavailable. Self-monitoring, watch for dizziness and excessive fatigue. Discontinue and seek help if hemoptysis or severe breathlessness occur. So let's have a summary of this entire video. What is percussion? The purpose of percussion. These are the techniques. Percussion, vibration, shaking, postural drainage. Observe technique. Percussion is loosening the secretion during inhalation or exhalation is called as percussion using a clapped hand. Vibration is mobilizing the mucus draining during exhalation. When to use during expiration after percussion. What is shaking? Enhance the mucus clearance on deep expiration in stronger patients. Postural drainage drain the specific secretions from any segment 2 to 3 times per day daily for mucus retaining conditions. In the next video, we'll be discussing about the history of mechanical respiration. Hope you guys have learned something new in this video. Happy learning.